Los Angeles is home to millions of people looking for a healthier lifestyle. Well, look no more. Your World Today is here and is a show offering you a wide array of topics to improve your quality of life. From a healthier living to making smarter decisions. Welcome to Your World Today.
Hi, welcome to Your World Today. I'm Kerrigan Von Pulley, and as you can see, we are at the Limb Preservation and Advanced Wound Care Center at White Memorial Medical Center. This is a brand new center, and we're going to take a look around. So come with me. Now here's a familiar face, Ophelia.
Hey, Carrie.
How are you?
I'm great. I was just waiting for you so we can go tour this place and go talk to Dr. Mathis.
Well, should we get started?
Let's go.
Okay.
All right.
I'll meet you over here.
Okay. So this is an awesome place.
Yeah, and I've heard great things about Dr. Mathis.
Yeah, me too. Let's go see him.
We are in a brand new center right now.
right.
This is the Limb Preservation and Advanced Wound Care Center at White Memorial, and as you can see, it's brand new.
In layman terms, this is the Amputation Prevention Center, and we're happy to have Dr. Mathis with us, Stanley Mathis. Doctor, welcome to the show.
Well, I'm happy to be here. Thanks for inviting me.
Thank you for being with us. What is this? What is this all about?
Well, they did a study here at UCLA that recently came out that was in the papers and in the media, and it showed that in our particular zip code, we had 10 times the amputation rate as they did in West Los Angeles. And there's a lot of factors for that. One of them is we have a lot of diabetes here. The other factor is that there sometimes has been a problem with access to the proper care. Thus, we have the Limb Preservation Center and the Wound Care Center to try to deal with those two issues.
So there's a lot of things that are happening in the community, and you guys are addressing them, which is fantastic. What are some of the specific procedures that a patient is going to expect when they come to the center?
Well, it's interesting. The center here is a really important part of our program, but it starts here with preventative care. What we want to do is we want to prevent people from getting open sores or ulcers or infections on their feet, whether they're diabetics or not. And that involves education and prevention. So that's why the outpatient clinic is here. Now, if they end up having a problem, we want to address that problem in a timely manner. What that means is that time equals tissue. So we need to get the people in. They need to have access to care, and that's why White Memorial Medical Center has been so kind as to sponsor this clinic.
So, Doctor, I want to ask you about the population around the hospital and diabetes. So, give us some numbers, some stats on the number of patients that you see and why this center is so crucial.
Well, it's literally in the thousands of people that are just in our zip code that have diabetes. And the issue is that if you have diabetes, you're at a lot higher rate to get an amputation than if you do not have diabetes. And why is that? Well, there's problems with feeling in the feet. Some of the diabetics just cannot feel things. Other times we have problems with circulation. And other times it is just keeping their sugar levels under control. And so all those things seem to lead to a higher chance of getting an infection. So we're trying to prevent that. And if they do get an open sore, we're giving them access, and we want to respond to that in a timely fashion. So the center you see here with all this great technology,
Right.
This is one of our x-ray machines. But we also have, this program exists inside of the hospital and outside of the hospital. We have an on-call team made up of a podiatrist, a vascular surgeon, and an infectious disease specialist 24 hours, 365 days out of the year. And so if somebody has a serious problem and they end up in the emergency department, we see them right away. And our goal is to treat them timely in order to prevent those amputations and save tissue.
So timely treatment is an important part for any of this. And also you mentioned technology. Could you describe just a little bit more detail about what it is we're standing in front of here?
Well, this is an x-ray machine, and one of the reasons why we have the x-ray machine here is because it does several things for us. One thing is when somebody has an open sore, we have to make sure that that open sore isn't associated with gas. Now, that terrible word, gangrene.
Gas?
Yeah, gangrene is a word that nobody wants to hear if they're a
Absolutely.
diabetic, right?
Yeah.
And really what you're dealing with gangrene is a lack of circulation. Now, sometimes it's dry, that means it's not infected, and other times it's wet, which means you have an active infection. When there is a wet active infection, sometimes those bacteria can create gas. Now, gas creates little poisons or like toxins, and that's what can make people so sick. Everybody's heard of blood poisoning.
Yes.
Well, that's kind of a layman term for getting bacteria into the bloodstream. And those bacteria that come from that gas inside of the tissues can cause poison, and actually that's what can cause people to get really sick or even pass away. So this little machine right here, we can take an x-ray immediately after seeing the patient. We can make sure they don't have an infection of the bone. We can make sure that there's no gas in the tissue. And we can see whether or not there's some sort of a bony structural problem
So
that
this
might be
guy
leading.
tells us that.
Yes, it might be leading to a reason why we have the sore forming in the first place.
So you can see what's happening on the outside, but this gives you a better look of what's going on inside and any issues that might be
Yeah,
there.
believe it or not, there's like 26 bones in every foot. And so, we don't have x-ray eyes, so we have the x-ray machine. And we have a tech here full-time. The clinic's open between 8 and 5, and we have a tech here that can take x-rays and tell us whether or not there's a special bone inside of the foot that's causing the pressure, or whether or not there might be the problem with the gas, or whatever the case might
Do
be.
you see why this show is so important? Just right now, I had no idea bones would get infected.
Yeah.
Did you know bones got infected?
I did not know the bones got infected.
Yeah, that's the technical term is osteomyelitis, but it's a bone infection. And the problem with some of the patients that we have, whether or not they're diabetics or they have kidney disease or they have another problem, they can lose their feeling. So you and I, if we went to Disneyland or to the swap meet or to the mall and we walk
Right.
too much and we get a blister, well, we stop walking. What do? They keep walking because they don't know it doesn't hurt. And so the first thing they find out is that their loved one tells them, hey, you're walking across and I see a little puddle. There's a problem.
right.
And so then they come in and they see us, and sometimes they're literally walking on the little bones.
Doctor, we have to go to a commercial break, but we're going to come back and we're going to continue talking about how we're supposed to take care of our feet and what you do here at the center.
You bet.
Okay, we'll be right back. Don't go anywhere.
This segment was brought to you by White Memorial Medical Center.
Welcome back. This is Your World Today. We're here at the Limb Preservation and Advanced Wound Care Center at White Memorial Medical Center, and we're going to continue our conversation with Dr. Mathis about the center and some of the specialties you have here.
Yeah, our center is very interesting because it took us literally about 3 years. We traveled to San Francisco, we traveled back to Washington, D.C., we consulted with Temple University to see what they had done. And what we wanted to do is, not only did we want to have timely care, we wanted to have coordinated care. So some of the things that makes us unique is that we have about 10 doctors of all different specialties that are involved in this limb preservation center.
How so, doctor?
Well, we talked about prevention,
Yes.
right? We're going to have endocrinologists here. And what happens is that some of the stats is that if you have an amputation, the chances of you, mortality rate is about 80% in 5 years. That's pretty severe. And what do people pass away from? They pass away from heart attacks and strokes and kidney problems. Because diabetes starts out as a glucose problem, a sugar problem, right?
Sure.
But then it turns into an inflammatory problem of all the blood vessels. So the big and the little vessels in our bodies are affected. And so what does that mean? It's our heart, it's our brain with stroke, it's our feet with the vascular disease, it's also our kidneys that have the little tiny blood vessels. So we have every one of those specialists involved in the care of our patients. So if somebody shows up with just a small ulcer, we know that that's just a sign of bigger things.
To come, sure.
So we're into timely and coordinated care. We meet every week together with all those different specialties. We oversee the different cases and patients we have in our clinic, and then we decide what the best treatment plan is for that particular patient.
Wow. I'm blown away.
Well, and so it sounds like, a patient, they can come in and no matter what stage they are, obviously we want them to get in early. But
Right.
if they're in later, we can help them as well. Is that correct?
Yes, and so it's really, really important. And again, I would emphasize, we are an inpatient. We're at the hospital. We're also here in the clinic. And the same doctors are going to see you in the hospital as see you in the clinic. So we have seamless care that goes back and forth.
Doctor, how many centers like this one exist nationwide? I mean, how special is the center?
Well, there are a lot of other centers that we studied. But in regards to having that many doctors
Right.
in one place, in an integrated place, I know of one other, and that's at the Mayo Clinic in Minnesota. So it's a very unique situation. There are lots of other centers that have a podiatrist and a vascular surgeon and perhaps a hyperbaric oxygen chamber available. But that's not what we were looking for. We were looking for a completely coordinated treatment plan for our patients, and that includes, like I said, 9 or 10 different specialties.
It's a team of 10 doctors working for the patient at all the different levels of disease, and plus you have an emergency room here and an ICU center in any case if needed.
Yeah, what's really important is because remember I said there was a 5-year mortality rate
Yes.
if you had a below the knee amputation? The reason is they don't die from usually getting another infection. They die from heart attacks, kidney failure, and stroke. So we're going to be screening for all of those things. Once we have somebody that demonstrates peripheral vascular disease or an open sore, they're going to be able to see our cardiologist, our nephrologist, our kidney doctor. They're going to also see our neurologist and be screened for stroke. So we're going to try our very darndest to try to help with the mortality rate and help people to live healthier and longer lives.
And it sounds like the patients that come in are going to see one doctor, and that's going to be a doctor that they're going to work with, they're going to recognize, and so there'll be that continuity.
Yes, it's really important that we have the continuity and again the coordinated care. And we have the inpatient again and the outpatient, and it flows back and forth seamlessly. So that's our important thing.
So, doctor, do you have a number, an aim to cut maybe these diseases, these foot ulcers?
Well, I'll tell you this, what
in
the studies
half or
show.
something?
Why have the coordinated care? Well, because the most recent studies that came out of Europe show that if you have one of these teams put together, you can reduce amputation rates reduce them of 80% from where you once were at your baseline. So, you know, to be able to reduce somebody losing a limb 80% by putting together this well-coordinated team,
That's huge.
yeah, it's
huge.
It's huge, and especially if you're the breadwinner for one of these families here in our local community. It's not just an economic, it's not just a health issue, it also becomes a social issue. And that's another reason why we're going to have a support group for our patients that have unfortunately lost a limb or something else before we could get to them.
So we can safely say that people who live around the White Memorial area are very lucky to have this center.
We are really, really blessed, and we've had great vascular surgeons and infectious disease specialists and foot specialists for a while here. One of them that's worked here for 30 years, you know, stopped and said, "It's about time. You know, I've been waiting for 30 years for this to happen in our community." So,
I feel it in your heart as well, doctor.
yeah.
You agree with that?
Yes, I agree with that. There are patients. This is our community, and we're going to do better.
And you're passionate about the care that you give to our patients, which is fantastic. You're fighting for them.
Yeah, well, you know, it's the White Memorial is a family, and we perceive that these are members of our family and our community, and we think that it can be done better. So that's why we've gotten together, and you know, to get 9 or 10 doctors together to want to work into one collaborative effort.
Does that passion, doctor, come from seeing people die? So because you were
Of something
liking
that's
this?
preventable too.
Yeah, it's because you see things that don't need to happen, frankly, and we want to get the amputation rate down. We want to keep people mobile. We want to keep them healthy. We want the breadwinners to stay breadwinners
Sure.
and have that self-image in their family, and it's important.
We're going to keep on talking about this.
And we're so thankful that you're part of the family
Yes.
here at White Memorial and helping the patients.
you care so
thank you.
much.
I apologize, but it's something I'm passionate
No,
about.
absolutely.
Well, I would get choked up myself, doctor. We'll be right back. Don't go anywhere. We're going to continue with Dr. Mathis.
Stay with us. Welcome back. We're here at the Limb Preservation and Advanced Wound Care Center at White Memorial Medical Center, and I'm a little bit nervous because I'm on an exam table.
Relax, it's okay. You're with Dr. Mathis.
Oh, go ahead and push the pedal. Let's see what happens.
Yeah, take me for a ride here.
Oh, it works. That's wonderful.
There we go. I don't need to be any taller, but thank you.
Yeah. Well, this room is a special room. We use it for castings and for fitting and dispensing shoe gear. Our feet are really, really important.
Why, doctor?
Well, what happens is that sometimes the pressure is not distributed evenly on the bottom of our feet. And when that happens, you then form a callus. Well, a callus is a way that the body kind of protects itself,
right.
And that's okay. But then if you continue to pound and pound and pound, that callus can turn into an open sore. And as you know, open sores can turn into infections. So here we have a special technician, which is called an orthotist. And an orthotist actually will fit you with shoes, inserts, orthotics, different type of devices that will redistribute that weight.
So you're doing things in this room that are maybe kind of simple by medical terms, but they can prevent a lot of issues down the road.
Yeah, what we found is that some of the patients, when they come out of the hospital and they need some of these shoes or inserts or some kind of a way to prevent their infection again, they're getting lost to follow-up. They're being sent out to other centers, and the coordination of care is not really there. So we have our own orthotist who comes in. He's going to be able to fit the patients and make sure that those pressure points don't reoccur.
Do you think you could fit to a size 13 in here?
Oh, no problem.
Okay.
We're just getting started. We got plenty of plaster pairs, I'll tell you.
Doctor, do you see only patients with diabetes?
No, we see patients of all different types.
Okay. And when you see a patient, you see them to prevent sores, or do you see them after they have sores?
We see both.
Okay.
We see everybody from somebody that has a callus, somebody that is in well control with their diabetes or wants to prevent a sore, all the way up to people that have gas gangrene, those people that could end up getting blood poisoning or go septic. So we see the whole different realm. And what's so great is that we have all the specialists here that are necessary in order to take care of you from the simple to the most complex.
Do you address bunions?
Oh, we address bunions.
Really?
Oh, absolutely. Yeah.
I had a friend that had bunion surgery and she couldn't move for a month.
Oh, yeah. A lot of the techniques have really, really improved.
Evolved?
Yeah, it's evolved. We have a lot of really good technology. And so most people that have bunion surgery are actually walking the day after in a special shoe.
Really?
And it takes a while for them to recover in men. But yeah, they're ambulatory right afterwards. And even with some of the people that have diabetes or have other problems, a bunion can actually cause a wound.
No way.
Yeah.
Okay,
And so
wow.
it's important. And so in this room, we do all those little simple things to kind of make sure that the pressure is distributed properly.
Well, that's why we're here, so you
From
can
the very severe
enlighten
to
us.
the simple preventative
Yes,
stuff, they
yes.
can do it all here. So
Yeah, we really emphasize the preventative care. And another thing that we do here in the center, we have a conference room that is just for education.
Right.
And what are we doing there? Well, we're going to teach them about diet. We're going to teach them about smoke cessation. And because smoking and
Aggravates everything,
Oh, my
right?
heavens, yes. The studies show that it actually reduces the length of your life by approximately 10 years.
Wow. Doctor, thank you for being so passionate about your work. That's really important for our community. And I personally just want to thank you.
and
You're welcome.
Thank you for being gentle with me on the exam table.
Well, it wasn't quite as good as Disneyland.
Well,
but at
not
least you
quite,
got
not
a
quite.
little ride with your size 13.
So we're out of time. This
Okay.
is the end of the show.
Here we are again, and we are so excited that we got to tour the Advanced Wound Care Center and Limb Preservation Center here at White Memorial.
Amazing technology. I tell you, I want to come here if anything happens to me.
We'll take good care of you.
Thank you, Doc.
I promise.
All right. Well, we'll see you. Remember, look us up on social media.
This is Your World Today.